everyone, and welcome to our webinar on interpreting in speech pathology settings. Today, I'm very lucky to have Elizabeth Ambrose with me, who will be presenting today's webinar, and she's a NAATI certified practitioner, as well as a certified practicing speech pathologist. So she has the experiences of both fields and is able to build a bridge between the two fields, and hopefully we are going to be learning a lot from her today. I'd like to thank you for taking the time from your very busy schedules. I know this is the silly season and we're all extremely busy, and I was very happy to see the numbers today. There's over 100 of you joining today, so thank you very much, and a big hello to all the university students out there as well. And thank you for registering too. My name is Fatih Karakis, and I'm the trainer and training and PD coordinator at All Graduates Interpreting and Translating. Just a little bit of housekeeping before we get things started. The webinar is being recorded, so if for whatever reason you're running late or you have to leave early or something happens and you can't watch it live, the recording will be sent to you via email. You'll get a link to the recording tomorrow. So don't worry, you have lifetime access to the recording after the live broadcast ends today. Your certificates of attendance will be issued to those of you who have registered for the live webinar, and you will be receiving these within the next 2 to 3 days or so. All right, also just another quick reminder, we are called Conversations, which is the training division of All Graduates. Now, the reason why we call it Conversations is because we like to keep our webinars interactive. Okay, so if you have any comments and questions, you can enter it into the chat function of your GoToWebinar app, whatever you might be using it on. So please, any comments you may have from your experiences or any questions you may have for Elizabeth, please put it into chat. I will do my best to ask all your questions to Elizabeth, and if we can't get to all your questions, we will put the questions together and then email it out to you as a FAQ format. All right, so eventually all the questions will be answered, if not all today. If you have a look at your GoToWebinar app, you'll find some handouts there. As usual, I have the AUSIT Code of Ethics. Just in case you haven't read it for today, you have it there for you. Also, Elizabeth has given me a couple of other handouts to give you as well. We've got the AUSIT guidelines for healthcare workers working with interpreters, okay, as well as a speech pathology glossary for you. It's a monolingual glossary, so you can work with that towards creating a bilingual or a multilingual glossary. All right, so a little bit about Elizabeth. Now, Elizabeth worked at the Australian Embassy in Paris. She was also the translator and interpretation coordinator at the International Criminal Court, where she worked for over 10 years, and then came back home and she completed her master's in speech pathology and is super passionate about speech pathology service delivery in the multilingual context. And currently she is working at Curtin University in Western Australia and is conducting research on bilingual language processing in stroke survivors, and still continuing to work as a freelance translator, and I believe is also an AUSIT member and takes care of their social media as well, a communications manager there too. So many talents. We have Elizabeth Ambrose here, and I'll hand it over to her because she is the reason why you're all here, not me babbling on. Liz, over to you. Thank you very much.
Oh, thanks, Fatih. That's great. And thank you for your warm welcome, and welcome as well to everyone who's here today. Thank you for taking the time to come to this webinar. As Fatih says, I'm really excited about this topic and passionate about it. So I hope that you'll find this webinar instructive, and I look forward to your questions as we go along. Now, we do have a lot of material to cover today. So I'm just going to get started straight away with the presentation. So if you can't hear me or if there's any difficulties understanding me, please just let Fatih know. Okay, so the webinar today is entitled Interpreting in Speech Pathology Settings. And, sorry, these are the topics we're going to cover today, hopefully, if we can get through it all. So we're going to have a little overview of what speech pathology is and what speech pathologists do. We're also going to look at where speech pathologists work and what kind of settings. So obviously, when you're working with them, you know where you'll be working. And the last part of this webinar is going to be looking at the challenges for interpreters working with speech pathologists and how you might prepare for those challenges or rise to those challenges and address them in your assignments. Okay, so a lot to get through. So we'll start straight away with an introduction to the field of speech pathology. Some of you may already have some idea or quite a lot of knowledge about what speech pathologists do. So bear with me if some of this might be repetitive or something that you already know. What is a speech pathologist? Speech pathologists are university trained allied health professionals. So a speech pathologist might have an undergraduate degree or a master's degree, and they're classified as allied health professionals. So they work in teams, health teams with other health professionals. You may be more familiar with some other types of allied health professionals, such as physiotherapists, dietitians, occupational therapists. They're all allied health professionals, okay? So I've put a picture of a smiling woman here because, like it or not, the fact is that the vast majority of speech pathologists are women. Don't quote me, but it's something like 97% of speech pathologists are women. So I will refer to speech pathologists using the pronoun she, because most of the time it will be a she, okay? All right, what do speech pathologists do then? So in a nutshell, speech pathologists assess and manage communication difficulties. I'm going to come back to those two words, assess and manage, but for the moment I just want to look at communication difficulties. You'll see that this is a question I'm going to answer in two parts. So this is part A, and this is probably the part that you are more familiar with about what speech pathologists do. Okay, so speech pathologists assess and manage communication difficulties. So the actual formal term for speech pathologists is actually speech language pathologists, or we often refer to ourselves as speechies. So why the terminology speech language pathologist? What is the difference between speech and language? So I'm just going to briefly address this topic, but if you want to read more about it, I have included a link down the bottom here to a great website. It's the website of the American Speech Pathology Association, which we call ASHA, and they have lots of fantastic information about speech pathology on that website. But we will discuss it a little bit now. So speech pathologists assist people who are experiencing speech difficulties. So speech production is basically a complex fine motor skill, and it's what I'm doing now. It's talking, okay? So it's the physical movement of the lips and the mouth and the lungs to produce these sounds that make up words, okay? So if you're trying to think about the difference between speech and language, I've suggested that you consider the situation of babies, okay? So babies can speak before they acquire language. They can say baba, dada, mama, that kind of thing. That's speaking, but they haven't yet acquired language, okay? So speech difficulties can be either acquired at some point in the lifespan, or children may be born with speech difficulties, okay? And their language may be perfectly normal, perfectly intact, okay? So I've just given a couple of examples here of speech difficulties. The first one is what we call dysarthria. Now, you'll notice throughout this webinar that I have highlighted some words in pink, okay? So these are words that I think that if you're working in a speech pathology setting, you should really know the equivalent of these terms in your LOTs or in your LOTs. Okay, these are key terms that come up very regularly in speech pathology settings. So Barty mentioned that there is a glossary attached to this webinar. It's only a unilingual glossary, but if these terms that I've highlighted in pink don't appear there, I would add them, and as homework or as preparation for your speech pathology interpreting assignments, I would do research to find out what the equivalent is in your language, okay? Okay, so dysarthria is one. Dysarthria is weakness or paralysis or poor coordination of the breathing muscles and the speech muscles that can impact volume and articulation. So in layman's terms, it's slurred speech, okay? And that can often be a consequence of someone who's had a stroke. They lose full control over their muscles, and it leads to slurred speech. Another speech difficulty might be present in someone with Parkinson's disease, okay? Parkinson's disease is a degenerative neurological condition, and we'll look at some of these terms a bit later, but that can also cause a wide variety of speech difficulties, actually getting the words out in a intelligible fashion, okay? So if you're going to be doing an assignment with someone who has Parkinson's disease, then I highly recommend you have a quick look at these two websites here. Parkinson's Vic is a wealth of information about Parkinson's disease, including the difficulties that such patients have with speech. There's also, I don't know if any of you are old enough to know Michael J. Fox. He was a famous actor, I guess, in the 80s, 90s, and he has Parkinson's disease. So he has a website, and I've popped it down there. So they're great resources if you know you're going to be working with someone who has Parkinson's.
I have also put those links into the chat option so that you can click on it and have a look as you're watching, Liz, as well, if you like.
Okay, so that's speech. Now, I just wanted to contrast speech to language because we know that we are speech and language pathologists. So as opposed to speech, language, I'm just going to read off the slide here, is a system of symbols, including rules, used to convey meaning, okay? So to try and get your head around that, I'll ask you to consider the case of Auslan, okay? Sign language, Australian Sign Language. So Auslan is a language that is a system of symbols, right, gestures. It includes rules on how to combine those gestures, and it's used to convey meaning, but it doesn't require speech, okay? So I hope that that helps you to see the difference between speech and language, because speech pathologists work with people who have difficulties with either or both, okay? When we talk about language difficulties, please be aware that speech pathologists tend to categorize language difficulties as either receptive or expressive. So receptive is language coming in, so your ability to understand words or your ability to read, and expressive language is your ability to talk or to write, okay? Hope that makes sense. I've got a couple of examples here of language difficulties, which I'm not going to address here because we'll address them later in this webinar, okay? And someone who has language difficulties may have perfectly normal speech. You may not even realize immediately that they have a language difficulty because they can speak just fine. Okay, quick quiz. I don't know if I could get your assistance with this one, Farty, but
Sure.
I've put a couple of, sort of common difficulties that speeches deal with. I'm just wondering if the participants in today's webinar might have a quick think about what category they fall into, whether they're speech difficulties or language difficulties. So the first one is stuttering. Yeah, a lot of people think speech pathology, stuttering. So would stuttering be a speech or a language difficulty?
One moment, please. Clarissa,
Anyone?
can we do a small poll, or should we just ask for people to put a comment in?
Anyone have any idea about what stuttering might be?
So
We've probably all
stuttering
met.
is stuttering a speech issue or a language issue, you're saying, right?
Yeah, that's what I'm asking. Yeah.
Yep, so I've got some comments coming in saying speech, speech, speech. Majority are thinking it's speech. Yep,
Yeah,
speech
that's
impairment, speech. Yep, so far 100% speech.
awesome. Yay, go to the top of the class, everyone. All right, what about when a child, maybe a 5-year-old child, says instead of, so they might say, I want that thing over there, that thing, and they can't say that thing. What would that be? Would that be a speech difficulty or a language difficulty?
Free for free. Remember that ad? All right, so this one we've got speech. I've got someone saying language,
Oh,
speech, language, sound.
mm.
Okay, mixed
Yeah.
bag, mixed bag.
Yeah, it's interesting, isn't it? I mean, traditionally, it would be considered as what we call a speech sound difficulty. So they have difficulty saying the sounds of the English language, but it can, in some cases, be an indication that someone's sound system, which is more of the domain of language, I suppose, is disrupted. So yeah, not so clear cut, that one. What about dyslexia? That's another word we hear thrown around quite a lot. Would dyslexia be a speech or a language difficulty? Anyone?
Dyslexia, speech or language difficulty. I've got a couple of languages coming in. Learning disability is another one.
Yeah, that's great. Excellent.
Language.
Excellent. Yeah, I mean, whoever said learning, you're 100% spot on. It's a difficulty learning language. So often people who have dyslexia can speak just fine, but they have difficulty learning new words or reading. So it's what we would call a language difficulty. All right, excellent. Well, that was just a quick little quiz just to
Well
see if
done.
you're all
Our practitioners are on the ball and they're listening, Liz. If you're wondering, they're definitely listening. All right. So we've got
that's great.
in that little poll, I can say 95% said language, a few said learning difficulty, and a couple said speech, but majority is on language. Yep.
Awesome, excellent. All right. I will show you some resources that you can go to read more about these kinds of things later on in the webinar. Okay. Okay. So just I will move through this slide fairly quickly as well, but maybe while we're going ahead, just have a little quick think about whether there are, hopefully there are, two different terms in your LOTE for speech and language and what they are. Maybe just make a quick note of them. Okay. Okay, so speech language pathologists assist not just with speech and language difficulties, but with all aspects of communication, okay? So communication is a bit of a broader term. Communication goes beyond just speech and language, and it includes things like listening and understanding. Now, listening is not hearing, okay? So that's the realm of audiology, hearing. Can you actually hear the sounds that are being said? It's more about listening and paying attention and taking in the message, understanding. So speech pathologists call that auditory comprehension. So that's another key word that if you're going to be working, especially with children who have speech or language difficulties, that you'd need to know what that really means and find the equivalent in your LOTE. All right, communication is also about reading. That's written comprehension, understanding the written word. Writing, that's a form of expressive language. Social skills, okay, communication is a two-way thing, isn't it? So in order to have successful communication, you need to be able to master speech and language, but you also need to know the rules of social communication, giving someone a turn, speaking when it's your turn, letting others speak, making eye contact. So there are all those social skills that go along with communications, which are of interest to speech pathologists. And finally, your voice. It's not essential for everyone. So obviously, we were talking previously about Auslan, so you don't need to use your voice to communicate, but it can be a factor that can either hinder or help communication. So speech pathologists assist people who are having difficulties using their voice. Okay, So that was a quick overview of what you probably already know more or less about speech pathologists. Does anyone know what else speech pathologists do apart from assist people who have communication difficulties? I'm going to
Yep.
tell
So
you
you can
because
just write your answers in the chat there. I'm
sorry,
sure Liz.
Fati, I've rushed ahead because I don't want to miss out on any time.
No. There's no issue. There's no issue.
But yeah, speech
Swallowing
pathologists also.
difficulty. Someone's come through with swallowing difficulty. They assess your ability to swallow.
Excellent. So some of you have heard about this little known area of practice for speech pathologists is assisting people who have swallowing difficulties. So the technical term for swallowing difficulties is dysphagia, again in pink. So find your equivalent in the load for that one. So dysphagia is a problem with drinking, chewing, eating. That can include taking your medication, sucking in the case of babies, or even controlling your saliva, okay? It's quite a serious area of practice because swallowing difficulties can actually be life-threatening. So people who have difficulty swallowing are actually at risk of choking, lung infection. That's where you'd get a piece of food or drink that goes down the air pipe into the lungs instead of down the esophagus into the tummy. And it also can put you at risk of poor nutrition and dehydration. So it's actually a really serious area of practice. For children, it's also very serious because if a child doesn't have enough nutrients, that can compromise their physical growth and their brain development, okay? So speech pathologists are involved in care for people who have swallowing difficulties. We'll come back to that more later. So just to give you an overview, I said I was going to come back to these two words, assessment and management, because speech pathologists do both. They assess and they manage communication and swallowing difficulties. So just a quick word on assessment. That's the part of the speech pathologist's work where they're trying to establish what is going on with a particular client or patient. So it's a bit like detective work because it's all about gathering information from various sources to get insight into a person's difficulties. So speech pathologists typically do this through interviewing either the person themselves or their carer about what the problem seems to be, observing firsthand the patient as they communicate or as they swallow. And usually speech pathologists, once they've done a bit of interviewing and observing, they start forming a hypothesis about what might be going on for this person and what might be the cause. And sometimes once they have formed that hypothesis, then they can conduct a test on a person, a swallowing test or a language test or a speech test to confirm their hypothesis about what the person's difficulty is. Okay, so it's a bit like detective work, and it can be a bit of a lengthy process. It's not always clear what's happening for a person. Management, on the other hand, is the aspect of speech pathologists' work where they provide care, okay? So they try and help the person who's having difficulties by providing therapy, and they also provide education. Speech pathologists spend a lot of time educating carers, family members, teachers, anybody who lives in that person's world and who interacts with that person, to try and educate them about what the problem is and how the problem can be overcome in daily life. Okay, and speech pathologists try to provide holistic care. So they usually work in teams, and the teams consist of the patient and the patient's carers, family members, friends, teachers, employers, and other health professionals, okay, to give a really holistic care to the person. Okay, that's speech pathology in a nutshell. Before we go on to the next little topic, Fatih, are there any burning questions?
No, all good for now. Thank you, Liz.
Okay, great. Well, we'll just talk a little bit about where speech pathologists work, and I've put a short list up here. Hospitals, schools, private clinics, the disability sector, aged care, and one emerging area is youth justice, actually, because it's becoming clearer and clearer that children with language difficulties can be on a trajectory that leads them into the youth justice system, which is really tragic. But it's an area where speech pathologists are coming more and more involved. I won't talk about that today, though. All right, let's have a quick look at hospitals. I'm sure you've all know what hospitals are, but I just want to give you a bit of a flavour about what speech pathologists do in hospitals. So our hospitals is a sort of a monolithic term because it's really quite a vast area. You have acute versus rehab versus outpatient care in a hospital. You have specialist areas like neonatal, newborn babies, oncology, cancer. So hospitals is sort of a big area. We'll have a quick glimpse first at the acute care setting. So a speech pathologist in an acute care setting might be looking after patients who have suffered a stroke or a traumatic brain injury. Okay, so this would probably be within the first 24 to 48 hours or so, or even the first few days of someone suffering such an injury or such a stroke. Okay, and the speech pathologist's focus in this context is an initial assessment of this patient. Okay, the patient may be in and out of consciousness and very vulnerable, and so the speech pathologist would be seeking to establish, can the patient swallow softly? Are they going to choke on their own saliva? Do they need a nasogastric tube? Okay, that kind of basic care. And can the patient communicate their basic needs? Can they communicate at all? Okay, so it can be a stressful and chaotic environment to work in. The rehab wards or sections of hospitals aren't as chaotic, but here the patient receives care to try to recover some of the functions that they've either lost or that have been impaired by the injury or the stroke. So the focus for speech pathologists in this kind of setting is to really do more of that detective work to find out what's going on for this patient. Have they lost their language? Are they having difficulty with their speech? What kind of language problems are they having? They can swallow food, but can they swallow drinks? So that kind of further assessment. And then, of course, hopefully in a rehab setting, speech pathologists can actually deliver some therapy to assist the patient to recover. It can also be a very sensitive setting because the patient themselves and their family may be coming to terms with the stroke or the injury and the long-term consequences. Stroke is considered a life-changing event. Okay, and then outpatient care. This is where speech pathologists work with patients who are actually out and about living in the community. They have chronic, which is persisting issues, or they have degenerative issues, so their condition is worsening, and they come into the hospital from time to time for an update or for further care, further assessment from a speech pathologist. So your classic case there is someone who has Parkinson's disease, which is a condition that progressively gets worse. So the person doesn't need to be in hospital all the time, but they need to come in for regular check-ins. Or someone with aphasia, someone who's got impaired language after a stroke, and they want to keep coming back to see their speech pathologist to keep working on their language. And the focus here is on long-term management. Okay, so quite different settings, all within the umbrella of hospitals. I just want to talk a little bit now about some of the diagnoses that you'll see if you work with a speech pathologist in a hospital. Probably one of the most common ones is aphasia. Don't know if any of you have heard of aphasia.
Anyone heard of aphasia, or anyone who has interpreted for an aphasia patient, or who you think might have had aphasia?
So it seems to be a fairly little known.
Yes,
yeah.
interpreted. I've got a couple here, a couple of ladies who've interpreted for aphasia patients. When I was an in-house interpreter for a hospital in Melbourne too, I did quite a lot of speech pathology jobs as well, and aphasia was one that I learned through that experience, and it's extremely challenging and interesting people to interpret for.
Yeah, absolutely. So these are people that have some kind of language impairment, which is caused by damage to the brain. Okay, so typically language is centered in the left hemisphere of the brain. So if that's where the stroke was, and the language can be impaired after a stroke. So someone who's had a stroke and who has aphasia can have difficulty understanding or verbally expressing themselves, reading, writing, even that non-verbal language of interpreting body language, for example, or gestures can be very challenging. And speech pathologists typically talk of aphasia in terms of mild, moderate, and severe, receptive versus expressive. Okay, so that's just something to be aware of. I think we do have time to have a quick look at what a patient with aphasia looks like. Every aphasia patient is different because every brain is different and every brain injury is different. So this is not necessarily representative. It's just intended to give you a bit of a flavour. I'm not going to play the whole video, but a bit of a flavour of what someone with aphasia, how they may speak, how they may use their language. So aphasia can be, generally speaking, split up into two broad categories. The first being Broca's aphasia. Broca's area is the language area of the brain. So people who have Broca's aphasia, which we call non-fluent aphasia, these people usually have pretty good comprehension. Their receptive language is quite good, but they might have difficulty getting the words out or finding the words. So I'll just give you a little look at this video here. This gentleman who has Broca's aphasia. We'll just watch for a few seconds. Hope you can all see and hear.
Can you tell us your name?
Mike Caputo.
And Mike, when was your stroke?
I was 7 years ago.
Okay.
And
what did you used to do?
Worked on a desk, seven sales and worldwide, and very good. Yeah.
Okay, so what we notice with Mike is that he seems to have trouble really constructing full sentences. He can say a few words. He often has to work pretty hard to retrieve those words and get them out. So that's what we would call Broca's aphasia. Oops. Okay. Sorry about that. The other broad category of aphasia is what we call Wernicke's aphasia. And this can be particularly challenging for interpreters because it's what we call fluent aphasia. So a person with Wernicke's will talk and talk and talk and talk and talk, but unfortunately they don't realise that what they're saying pretty much lacks meaning and doesn't make much sense. So I'll just give you a little introduction to Wernicke's aphasia by playing this video. Listen to what he has to say.
I'm happy. What are you doing today? We stayed with the water over here at the moment.
Liz, are you able to turn your volume up a little bit more on that?
With luck for him. So we're on a cruise and we're about to get to June. Sort right here, and they'll save your hands right there.
Yep, that's better.
Right at the moment, they don't show them. The iPad that we were doing. Like here. I change for me and change hands for me.
All right, you can go back and listen to these. Sorry if the volume was not quite satisfactory. You can go back and have a listen to these, but or just watch them directly on YouTube. But this chap Byron's difficulty was he didn't seem to understand the questions that were being asked of him, or maybe he thought he had, but his responses didn't really match the questions and didn't make a whole lot of sense to those of us who were listening to him trying to understand what he had to say. So I just show you those videos, just as I said, to give you a little bit of a flavour as to what the different types of aphasia can look like. And you can definitely find out more about aphasia by checking out these websites. I highly recommend, if you are going to be interpreting for someone with aphasia, to do a bit of extra reading. I wanted to quickly talk about cognitive communication disorder, which is another one that you can see in hospitals. So cognitive communication disorder is where the non-linguistic cognitive processes are disrupted. So we're talking here about things like memory, attention, executive functioning, that's things like inhibitory control. And these, although they are cognitive processes, not linguistic processes, they all support the communication process. So in order to communicate, you need memory, because you need to be able to remember what someone said to you and what you've said to them. Memory is essential for effective communication. Attention, you know, if someone's talking and you just can't keep focused on what someone's saying, that's going to hinder communication. And often these kind of disorders are seen in patients who have had an injury to the right hemisphere of the brain, because that's where these cognitive processes are centred. So someone who's had a traumatic brain injury or a right-sided stroke, someone who has dementia, may suffer from cognitive communication disorder. So these are the kinds of difficulties and behaviours that you might see in someone with such a disorder. They have difficulty with the pragmatics or the social aspect of communication. They may have poor turn-taking skills, can't maintain eye contact. They might not have the attention or concentration to keep up with the topic of conversation. They might not really be able to understand the nuances of humour. They might not be able to monitor themselves for what they've said and what they were going to say next, where this conversation's going. The question of inhibitory control is also really interesting, because it's like removing a filter. And if someone doesn't have a filter, they can say all sorts of socially inappropriate things. Okay, just moving through this fairly swiftly because we have so much to cover. Another diagnosis that you'll regularly see if you work in hospitals with speech pathologists is dysphagia. Okay, that's what we talked about previously. It's that swallowing difficulty. So swallowing is also a complex motor task that uses no less than 26 muscles of the mouth, the face,
Wow.
the throat. Yeah, it's extremely complex. It makes you sort of wonder how you just do it automatically without thinking.
I just swallowed after that, and now from now on, every time I swallow, I'm going to really appreciate it. 26 muscles. Wow.
Yeah, and the nerves, of course, because the nerves are what sends the messages from the brain to the salivary glands and all the rest. So it's really complex. But yeah, dysphagia has a great number of different causes. So babies can be born with dysphagia if they've suffered some kind of brain damage, or if they're born with some kind of structural abnormality. So you may have heard of cleft lip or cleft palate. That can really impact upon a baby's ability to swallow. Adults as well may acquire difficulties with swallowing after a stroke or any other kind of brain damage. Yeah, any kind of damage to the structures of the face, the throat, where there are nerves that are involved in swallowing. And yeah, swallowing difficulties can also arise in degenerative diseases such as Parkinson's. So when you're working with a speechie who has a dysphagia patient, they'll be doing both assessment and management. So on the assessment side of things, they'll be looking at how a person is able to control their muscles that are involved in swallowing, and they can do that at the bedside. So a patient that's just come out of a stroke can actually just be tested in their hospital bed. Usually a speech pathologist, for example, will ask a patient to poke out their tongue, to smile, to pucker their lips. It's a way that speech pathologists can assess whether these muscles are working correctly. All right. Sometimes speech pathologists need to go beyond that kind of bedside assessment and do what we call a nasoendoscopy, which is basically when a camera is inserted into a patient's nose and fed back down through the back of the throat, so that the camera is basically filming the vocal cords, which are about here, because it's the vocal cords which close when you need to swallow, which is what protects your airway. So the vocal cords close, that means no food and drink can get past them and go down into the lungs. So if those vocal folds can't close properly, food and drink can go down into the lungs. So a nasoendoscopy can give you a really good view of the vocal cords and see what they're doing. And in very severe cases, speech pathologists might need to refer a patient for what we call a video fluoroscopy, which is essentially an X-ray of someone swallowing. So it's fantastic technology, but you can essentially see exactly what happens to a piece of food or drink that's swallowed, what's happening with the vocal folds, what's happening with the throat. It's a very useful tool for speech pathologists to see exactly where, at what stage of the swallowing event, the problems are arising. Okay, so you could be present as an interpreter, you could be present at any of those kind of assessments.
I did quite a few of those. It's quite interesting as well, interpreting in those contexts, and just having a look at through the X-ray and looking in awe how the whole thing works.
Absolutely, Fatih. Yeah, it is really quite impressive. Speech pathologists will work with patients who have dysphagia to try and assist them. This may comprise of recommending changes to the texture of food and drinks. It may consist of helping patients with exercises that can help rebuild muscle strength. It might also involve educating patients and their carers on safe swallowing techniques, which I won't go into, but there are actually a range of techniques that you can use to make swallowing safer. And in severe cases, speech pathologists can recommend non-oral feeding for a patient. So yeah, basically going on to what we call a PEG, receiving a nutrition through a tube. Okay. So that's hospitals. If anyone does have any questions about hospitals, let me know. We can either deal with it now or later.
Feel free to put your questions through, ladies and gentlemen, and we can ask Liz as we go. Nothing so far, Liz, all yours.
Okay, otherwise, just moving away from that hospital setting, speech pathologists also work regularly in aged care settings. So in these settings, speech pathologists will work with residents to help them manage both communication and swallowing difficulties. So typically, speeches will not only work with the patients, but also with care workers, kitchen staff, and family members. And all of these are really important because patients may have requirements for modified diet. They need to be able to communicate with the residents. So speech pathologists have a really important role to play in the aged care setting. One challenging diagnosis that you do come across in the aged care setting is dementia. Dementia is actually an umbrella term for a range of syndromes, including Alzheimer's, but it's basically all the syndromes are characterised by neurological deterioration. Okay, so it's the brain wasting away. It's a degenerative disease. Okay, and I guess its hallmark feature is memory loss. That's what a lot of people associate dementia with, is the memory loss, and it can really impact upon a person's daily life and quality of life. Often people with dementia do have an impaired ability to communicate. They may ramble, they may, a bit like Wernicke's aphasia, have this sort of rambling, empty speech. And feeding can also be an issue, but we'll come to that a little bit later. If you know you are going to be working in an aged care setting, even if you're not sure if your patient has dementia, you can come across other patients in the environment that do have dementia, and it's always really good to know a little bit about dementia and how to communicate with people who do have dementia, because it's not an easy thing to do, and it can be a little bit disturbing. So I would highly recommend all of these resources, targeted resources about how to communicate with people who have dementia. Yeah, leaving behind aged care for now.
Yep,
I know that was very brief.
Thank you. Just on that note, conversations, interpreting and translating are in talks at the moment with some institutions. We are going to be launching a 5-part series of aged care webinars next year. We are working with Dementia Australia as well as Palliative Care Victoria, Incontinence Australia, and Centre for Aging. We are working in partnership with them, and there will be a 5-series free webinar series on aged care starting January next year. So keep an eye out for that.
Good. Yeah, it's a challenging area to work in, but it's so satisfying because you can make a real difference to people's lives.
Definitely.
Okay, so another huge area where speech pathologists work is in schools. So schools vary enormously, not just from state to state, but from school to school. But a lot of schools do conduct formal and informal assessment of English language. Okay, English language is really key in the school setting. So you have some schools that systematically screen every kindergarten child or every year 1 child to see if any of them have a speech or language difficulty, because when it comes to paediatrics, the earlier that a child can receive care, the better it is. Okay, so speech pathologists really advocate for early intervention. So it's great to hear when schools do have these assessment drives where they just test all the children, and because inevitably there will be a child in every single class that has some kind of speech or language difficulty. So it's a bit tricky because interpreters wouldn't really be heavily involved here because it is in English, okay? So you probably wouldn't be involved in working with a speechy in that kind of setting. But what this can lead to is that if a child is identified as having a speech or language difficulty and that child speaks another language, inevitably the parents will be called in and the discussion will be had, I suppose, as to whether the parents have noticed any difficulties that the child might be experiencing when speaking that other language. It's not necessarily the case. A child who has speech or language difficulties in English may have no speech or language difficulties in their other home language, but it can be the case. So this is more where interpreters would become involved. So an interpreter might be interpreting between a teacher who's picked up these speech or language difficulties and a parent who might not speak English very well, to discuss about getting the child assessed in their home language. And then obviously working with the parent and the child and the speech pathologist to conduct an assessment, which can be very challenging. So that's where speeches sort of come in the school setting. I just wanted to sort of put a big warning up here, because the research evidence clearly demonstrates that tests for language and speech, which are translated directly from one language, so from English, for example, will not provide meaningful information regarding the child's language abilities in another language. So in Australia, speech pathologists have a few language and speech tests that they systematically use to test children. You can't just translate that into Indonesian or Farsi or Vietnamese and expect it to give you an accurate result of how that child speaks in that language, because why? Why, you ask? It's because not only because there are differences in language structures, but also there are different language development patterns across languages. So just to take a really simple example, so if a speech pathologist is administering a test for speech sounds, can this child say the sounds of English? And they've got this lovely little test that they use to test whether a child can say the sounds of English. That can't just be translated, because the other language probably has a whole bunch of other sounds that are used that don't even exist in English. So I know French, and I know that the sound doesn't exist in French. So that administering an English test on a French student, it wouldn't work, and it wouldn't give an accurate result. And a lot of these tests sort of give you a result that say, yes, your child is this age, and therefore his score shows that he is within the normal range of abilities. So that's all those kind of tests are standardized against the population. So if you have a child who speaks many languages, they're not a typical speaker of that language population. So language develops differently in different languages. So I think most speech pathologists are very aware of this, but it's also useful for you to be aware that you can't just take a test that's used to test a child's language or speech in English and just find the equivalence in your language and administer it to the child. And in fact, there have been efforts around the world to more adapt tests, okay? Because speech pathologists need these kind of tests to diagnose children, so it's really useful to have them in other languages, but it's a massive undertaking, and it involves a huge multidisciplinary team to create an equivalent test that's testing for the same things but in another language. Okay, so just really wanted to point that out to you. I hope that's
Liz,
clear.
That's a very, very good point there that you make, especially in a country like Australia, where, you know, we are one of the most multicultural countries in the world, and so many. I mean, I was one of those kids when we arrived in Australia. You know, I was like 8, 9, and who knows, maybe I had some test like this given to me. No, have no idea. But so what happens if you have a look in aged care, for example? You have mini mental. So they've adapted that to the Rudis test, as you might know, and it's more towards multicultural patients, where it's more about you know, cognitive skills and remembering and drawing, as opposed to language skills. So they've kind of adapted it. I think Australia was the first one to do it in the 80s. They've adapted to that assessment to the multicultural context. Does speech pathology plan to do something like that? Are there works? What do they do in Australia in the time being?
Oh yeah, I mean, it's definitely a growing area, because there is this growing realization that each language sort of requires its own test, and there's a lot of work being done, and I think it's only going to increase in the future. But for example, one very common test that's used to test aphasia is called the CAT, the Comprehensive Aphasia Test. Okay, it's an English test, but in the European Union, there's a massive project afoot, which is basically to produce the CAT in the 27 or 28 languages of the EU. So, but it's a massive undertaking, and that's just for one test, for one language issue, aphasia. So it will take a while to, I think, develop and build up a corpus of tests that can be used in other languages, but it's definitely ongoing, and where they don't exist, speech pathologists have to find other means, often what we call informal assessments, to get an insight into.
Interpreters, I think, would have a big undertaking here, wouldn't they? I mean, I guess they would have to be that cultural, build that cultural bridge as well, and inform the professional, the speech pathologist, about the non-existence of certain sounds in that particular language, I guess.
Yeah, that's why I sort of say it's a sort of a multidisciplinary undertaking, because you need linguists, you need, potentially interpreters and translators, speech pathologists, all working together to come up with something that's equivalent or might be very different, but it's equivalent. It tests the same thing, but in a very different language. So it's a fascinating area.
Watch this space.
Okay, but in schools and working with paediatric populations, some of the major diagnoses are what we call DLD. So this is developmental language disorder. Put it in pink there for your glossary. This is a severe language problem which has no clear medical cause, and it actually affects so many more children than you'd realise, because it's not something that people talk about. You don't hear talk of DLD much, but it is a severe problem, and it can be associated with lifelong difficulties, poor academic, employment and social outcomes. So early identification and intervention is prescribed for developmental language difficulty. It's essentially where a child has difficulty acquiring a language, learning new words, reading, writing, following instructions. It's very complex, and I've put some resources there. I think there's something like, I don't know the figures exactly, but essentially, statistically, it's something like at least a child in every classroom would have developmental language disorder. It does require a diagnosis, though, and the diagnostic process is quite long. The other disorder that you might come across in schools is ASD, autism spectrum disorder, which is a neurodevelopmental disorder of unknown cause. Where this comes in is that it can lead to social, behavioural, communication difficulties for a child. So you've probably heard of some autistic children who have no speech at all, they're non-verbal, and other children who have autism who can speak fine, but they just find it very difficult to interact with other children, that social aspect of communication. So it's a spectrum. I've put some reading references there for you if you want to find out more about autism, if you know you're going to be working with a child who has autism. I think this might be the last one, the disability sector. It's not necessarily what you think of when you think of speech pathology, but speech pathologists do work with people who have disabilities, so neurodevelopmental disorders, so people with Down syndrome, cerebral palsy. And I'm not going to speak about this one in great detail, partly because it's not my area of specialty, but it can be really interesting because this is the area where often clients are using what we call AAC devices. So these are augmentative and alternative communication devices, and they're basically devices that help people communicate. So just to give you an example, I met a wonderful child. He was about 16 years old and he had cerebral palsy. He couldn't talk really, and he could barely move actually, and he was in a wheelchair, but he could move his head. So with his head, he would tap on his chair and there was a button, and just from that motion, he could write messages on a device that was connected to his headpiece on his chair. It was absolutely astounding. But you can imagine that someone who has cerebral palsy, who has several languages, might want to be able to communicate in all of their languages on their AAC device. So there's an opportunity there for interpreters to work with speech pathologists. And just the final area, sorry, the disability sector was the second last. This is the last, private practice. You've probably seen them all around. There are private speech pathology clinics in most suburbs, and speech pathologists just work privately there. It's not the government sector, but speech pathologists cover all kinds of speech and language difficulties in their private clinics, but oftentimes it's literacy, so working with children to help them with their reading and writing difficulties. Can also be working with patients who have voice difficulties. And one emerging area here, which is really fascinating as well, is transgender children who may be searching for a new voice that matches their gender. Speech pathologists can be involved there. And fluency, that's the sort of the technical term that speech pathologists use for stuttering, okay? Fluency, because stuttered speech isn't fluent, it's kind of staggered, so we call that fluency. A lot of parents take their children to see private speech pathologists to work on their stuttering. Okay, this is the part of the talk that's probably most interesting for you, although we do have to go through all the...
No, I mean, context is very, very important for an interpreter, and we can't really comment and learn about the interpreting side of things unless we know the context. So thank you very much, Liz, for giving us all that invaluable information about speech pathology, because the more we know about the context, the better we will be able to interpret, having the confidence and the knowledge.
Absolutely, yeah. So let's get into the nitty gritty. Just from a speech pathologist point of view, for them, the current recommended best practice is to provide care in all of the client's languages, not just the one that the speech pathologist speaks, okay? So that's the current best practice, and that's endorsed by SPA. Now, SPA is kind of like AUSIT for speech pathologists. It's Speech Pathology Australia. It's the National Association for Speech Pathologists, and it's in their position statement on working in a culturally and linguistic diverse society, where they set out this recommended best practice for providing care in all of the client's languages. So yeah, I think speech pathology work in terms of interpreters, the swallowing aspect is very similar to other interpreting in other healthcare contexts. That's my humble point of view. It's when a speech pathologist sees a patient for swallowing difficulties, the interpreter is pretty much in their standard role of facilitating communication, transferring the message from one language into another. It's when it comes to consultations for communication difficulties that things become a little bit more tricky for the interpreter. So we can ask the question, and we must ask the question, as to whether speech pathology is a special interpreting context, which I would suggest it is. So unlike other healthcare settings, like when you see a podiatrist or a dentist, a speech pathologist isn't just interested in what the patient is saying, but how the patient is saying it. It's almost more important in some ways. So speech pathologists need to be able to identify, are there disordered forms of speech, inappropriate social skills, sound distortions? Is the child saying a sound that doesn't exist in that language? Language errors. Can the child even conjugate a verb correctly? And they have to rely on interpreters to do this in the low. They can do it perfectly well in English and get a very good idea of a child's or an adult's language and speech skills in English, but in order to get a window onto a patient's skills in the other language, they rely on interpreters. Okay, so the problem is, though, that interpreters do not necessarily have the training or experience to identify those things that speeches are looking out for in their detective work. And even if they could, doing so might require them to go beyond their strict role, okay? So we have to talk about the code of ethics here, and I'll just mention it briefly, but according to the code, the focus of an interpreter's work is on transferring the message, not commenting on how the message was spoken, but it's the content. That's in an interpreter's job. And in fact, you know, interpreters are generally encouraged not to do anything but that. So there is a little bit of tension there, because speech pathologists might need an interpreter to go beyond their traditional role. Okay, so this is where, thankfully, we have the AUSIT guidelines for health professionals working with interpreters. Now, this is a document that Fatih has uploaded to the webinar, and that you can get off the AUSIT website as well. It is a document that's directed at health professionals, but this is an interesting document because it does recognise two settings where that present, extraordinary challenges for interpreters. And those two settings are speech pathology and mental health. Okay, so there is a recognition in this document that these settings provide extraordinary challenges for interpreters, and interestingly, that the general ethical principles of the code may have a different application from your other sort of standard interpreting settings. Okay, so this kind of gives interpreters working in speech pathology settings a little bit of leeway and a little bit of license to perhaps step beyond their traditional role boundaries, if they feel competent, of course. There is this on this issue of this question of whether speech pathology is a special interpreting context. You can also refer to these two resources. One is a document similar to the AUSIT document that was published by the New South Wales Healthcare Interpreter Services, that's available online. And also there's some academic research that I've cited there. It's Australian research that talks about the tension that exists for both interpreters and speech pathologists when they work together. And one of the main tensions that comes out of that research is the expectations, role expectations. Okay, so we're going to talk now just about a couple, I think 3 challenges, very concrete challenges that can come up for you as interpreters when you're working in speech pathology contexts, and how you might try and navigate those challenges. Okay, so the first one, and I've already alluded to it, it's the role boundaries. I mean, this is really a fundamental issue for interpreters in this kind of setting, because as we've discussed, speech pathologists need you basically to comment on how messages are conveyed, not just the content of the message, and they will ask you to do that. So for example, I'm referring to the slide here, you may be asked to comment on the articulatory precision of an elderly patient when he talks. Now, what is articulatory precision, and what in speech indicates articulatory precision? Okay, so if you're not a speech pathologist, you might not know. You might not know even what that means, and yet you're being asked to comment on it. That can put you in a very difficult situation. You may not feel competent to do what the speech pathologist is asking you to do. Similarly, if you're working with a paediatric patient, a paediatric client, a child, and the speech pathologist asks you perhaps to comment on the complexity of the grammatical forms used by the schoolgirl. The speech pathologist might want to know if the schoolgirl uses subordinate clauses or modal verbs or any other kind of grammatical form, which you might have not much understanding of. You might have heard these terms, you might be familiar with them, you might be a linguist and you might be perfectly across it, but it's not necessarily the case, because not every interpreter is a linguist. It comes down to this question of you being asked to do something that you may feel is beyond your competency. Okay, so how are you going to manage in this kind of a situation? Okay, I just want to note that what I've got here on this slide is not the holy grail answer of what to do. It's a suggestion about how you might navigate such a situation, because every interpreting situation is different. Every speech pathologist is different. Every interpreter is different. We all come to this practice with our own set of knowledge and skills. So I don't want you to take this as you know, the be all and end all, but it is just a suggestion of ways that you might try and get through these challenging situations. So speech pathologists are very accustomed to working in teams, yeah? So what I would suggest is that as a starting point, interpreters can indicate that they're willing to assist if possible, okay? That's, you know, why interpreters are there. They are wanting to assist in communication, facilitate communication. So you can indicate that you're willing to help. Right? That just shows your goodwill to the health professional. But you can remind the speech pathologist that your role, your traditional role, is just to interpret the content of what is being said, and that you don't necessarily have the skills, or that you don't necessarily feel competent to go beyond that role, that traditional role. It'll be up to you to decide how far you can go. And I think that it's really important to speak up when you don't feel competent, when you're being asked to do something that you're not quite sure about. I think that definitely demonstrates your professionalism as an interpreter. And I think if you've shown your willingness to assist, then later on, when you sort of push back and say, I don't think I can do that, there's already that goodwill that's been established, okay, that will allow you to work together with the speech pathologist to find a middle ground of where you feel comfortable. You could say, look, I'm not sure what you mean by articulatory precision. Can you sort of give it to me in lay terms? What exactly are you looking for? Can you give me an example? Can you explain it to me? And then maybe you will actually find that you can help the speech pathologist out with what they're looking for. Maybe you won't. Maybe it's challenging enough for you just to focus on transferring the message, and that's all you can do, and you don't have the cognitive ability or space to be able to go beyond that and be able to say, oh, actually, also I noticed that when the person was speaking, they tended to speak with really low volume or whatever it might be. So this is sort of just giving you some tools that you can use. I would also, if you're feeling very confident and feel you can assist, a speech pathologist who asks you to, help out with identifying some of these features. Also, just would caution you, a word of caution, to respect the speech pathologist's role instead. And so at the bottom of the slide here, I've just asked you to consider the difference between making a comment such as, oh, the patient has dysarthria when he speaks Vietnamese. That comment, as opposed to, I've noticed that the patient slurs his words when he speaks Vietnamese. Because there is a difference, because it's up to the speech pathologist, really, it's their role to diagnose whether a patient has dysarthria or not. And they're relying on you to sort of indicate whether there are signs that there might be dysarthria present. So that might be things like slurring words or low volume. Okay, so I don't know if that makes sense, if that's...
Definitely. Look, if I can make a comment on this, that'd be great. And I've got a couple of other comments from our interpreters here too. Now, this is exactly the reason why I wanted to talk about speech pathology and invited you to do this webinar. So I'm really, really glad you're touching on this. I think what you say, collaboration is the key here. Even though the Ausid Code of Ethics says, clarity of role boundaries, but I think speech pathology and interpreting in this particular setting is a different context altogether. And the speech pathologist does need the assistance of the interpreter at times, especially within regards to sounds and linguistic issues of the LOTE. So that's why I think it's very, very important here that we understand, yes, there is the Ausid Code of Ethics, but with speech pathology, it is quite a different and special context. And we could all agree that with healthcare interpreting, everyone is there, the doctor, the interpreter, the patient even, towards the one goal of making the patient better, improving their healthcare quality. And I think especially interpreting in these settings, the keyword collaboration here, if we can, is very important. Now, just some comments which are very, very relevant to this, Liz. I've got an interpreter saying the problem is we don't very often get told we are interpreting for speech therapists beforehand. We just get told to go to the clinic, so we have no way to prepare. I may make a comment on that if that's okay. And having interpreted for language service providing agencies for a long time as well, I always went even over the language agency and contacted the hospital directly or the clinic directly and said, I've got a patient, I've got an appointment this time, this day. Can you please tell me what clinic is being run? At least I know what kind of a job I'm going to beforehand, even if the agency might not have that information. And because they're not giving me any personal information about the patient, it doesn't really fall under compromising confidentiality or privacy issues. So I just call up beforehand whatever institution or clinic or hospital I'm going to and say, look, I've got an appointment on this day as an interpreter. And I usually call their language service department if they have one, and their interpreter booking department or language services department, and they love it. They're like, oh, great, someone who's interested in what they're doing. And they give me all the information that they can give me. So I find that really, really helpful. And that's my advice to all of you interpreters out there. You can always get to more information than what is provided to you by the agency. And I'm saying that working for an agency as well, okay? We just go above and beyond. You can definitely get more information than the few words that's given to you on that job offer. Another one is, the term interpreting is not necessarily a rigid, inflexible term. In speech pathology context, the interpreter comments from any linguistic aspects, articulation, pronunciation, grammar order and register, etc. I feel comfortable that our code covers us in this respect, but any improvement of our code is welcomed. Okay, so last update was 2012, 2020 now. So yes, you know, Liz, you are part of OSIT here as well, and I'm sure there's works being done on that too. Another question or comment, isn't it challenging for interpreters when they're asked to interpret for a child in early stages of primary school who is just building new vocabulary in numeracy and literacy in English and not in the other language? How can a speech therapist make sure that her assessment was accurate for this child?
Yeah, especially if the speech pathologist doesn't have direct access to that language. Yeah, it's, I mean, assessment is not a sort of a one-time, one-off thing as well, you know, especially speech pathologists working with children. Assessment is ongoing, yeah. So, and obviously, if you've got a speech pathologist who's switched on and aware of, you know, how children who are bilingual develop a little bit differently from monolingual children, yeah, there's hopefully an understanding there that the speed of acquisition of the second language might be a little bit slower, especially if you're not in the context where the second language is spoken in the community. So it's also about the speech pathologist gaining that kind of specialist knowledge working with multicultural communities.
Thank you for that. That's it for now, Liz. We can keep going. Thanks.
Awesome. I know that time is running out. I have just two more challenges that I would like to discuss. So maybe we could say we spend about 5 minutes on each. So yeah, so then the next challenge, with that role boundaries one aside, another challenge that might come up is just the difficulty of the mechanics of interpreting for someone who has disordered speech and language, like Byron, who we saw earlier, who had Wernicke's aphasia. You know, how do you interpret that kind of speech that's rambling or empty, that doesn't have much meaning? Or how do you interpret for someone who you can barely make out what they're saying because they have dysarthria or slurred speech? So that's a sort of a challenge of a different order. I would suggest here definitely the tools that are already in an interpreter's toolbox, namely making use of an interpreter's interjection. So if you can't understand what somebody is saying, you can't interpret it. So in this situation, I would definitely recommend the interpreter just speak up and say, the interpreter would just like to interject to note that the interpreter cannot understand what the client is saying. And then the speech pathologist will hopefully kick in and either ask for a repetition if that is at all appropriate in the situation, or direct the flow of conversation. But what would be ideal is if you were able to have a few moments before the session, just with the speech pathologist, without the patient being present, to agree in advance about how to deal with this kind of situation. So if the interpreter can barely understand anything that the client is saying, instead of constantly interrupting and saying, the interpreter doesn't understand, the interpreter doesn't understand, maybe you can agree with the speech pathologist in advance that such interjections won't necessarily be necessary all the time, but that the interpreter might just make a note of difficulties or words that came up that were difficult, or rather than every single time basically intervening in the conversation. So you really need that collaborative spirit really needs to be present, because it is a teamwork, and you really need to agree in advance, because it's not fair to you, and it's not fair to the patient if the speech pathologist and interpreter don't even have a common strategy for how to facilitate communication and assessment of a client. So finally, this last challenge I just want to quickly go over as well is the challenge of accuracy, okay, because interpreters are supposed to, according to the code, interpret faithfully everything that is said. So I just maybe start with the second point there. If a client's comments are rude or inappropriate, so it's particularly important in speech pathology settings not to tone that kind of language down. I know there might be a tendency to do that in other kinds of settings, but in the speech pathology setting, it's really not appropriate to tone that kind of language down, because rude and socially inappropriate language can actually be like a diagnostic marker for a speech pathologist, and they go, oh, okay, there might be some right hemisphere damage here, or whatever the case. So that's really important. So as uncomfortable as it is, you will just have to interpret those kind of that kind of language as is. Speech pathologists are pretty used to it though, so I don't think you'll offend anyone. But also, it might arise that the speech pathologist has asked the client a question, and the client clearly doesn't understand, even though you've interpreted correctly. The client just doesn't understand. And maybe perhaps in other settings you might just rephrase what you've said or repeat what you've said. In speech pathology settings, it's really important not to do that, because the fact that the person hasn't understood is something that the speech pathologist really needs to know about. Okay, so on the next slide, I've got strategies of how to deal with these kind of situations. Basically, I've already gone over them. It's really important, especially during assessment tasks, when the speech pathologist is trying to get an understanding of what the client can and can't do. It's really important not to help, as much as you'd love to not to help the client by repeating or rephrasing questions, and also not to polish up any, grammatical errors or inconsistencies, because that could lead to a misdiagnosis. Other challenges, and these are challenges that are not necessarily specific to speech pathology, but they definitely can arise. We've talked about terminology and the importance of preparing the equivalents in your LOTE for some of the key terms that come up in speech pathology settings. Patient behaviour can be another really big challenge for interpreters, because often you're dealing with either very young children who may have behavioural issues, or older populations who may have conditions like dementia and where behaviour is an issue. Navigating those situations can be really delicate, and I would suggest that it's really the speech pathologist who needs to be able to take the lead when it comes to behaviour management. They've got a lot of experience in it, and unlike you, who might only see one dementia patient every 2 months, they might be working with dementia patients every day. So I would definitely tend to defer to the speech pathologist for managing behaviour, because it can come up a lot in speech pathology. The rapport building is actually really important. I know it's really important in other settings as well, because often interpreters are seen as a bit of a hindrance, because they can sometimes be seen as preventing a speaker from really gaining rapport with another person. So I'm thinking, for example, of police interviews, right? So police interviews, in a police interview, the police officer usually likes to be able to build some kind of rapport with someone that they're interviewing. And if they're having to go through an interpreter, that can be considered as a real negative. But in speech pathology settings, it's really important to try and find a way for not only the speech pathologist to build rapport with the client, but also for the interpreter to be part of that rapport building effort, because the interpreter is a really essential part of the team. And there is evidence actually that suggests that in speech pathology settings, it's not just the therapy or the type of therapy that is delivered to clients that can impact on outcomes, but it's also what we call the therapeutic relationship between the speech pathologist and the client that can have actually quite a significant impact on outcomes. So that therapeutic relationship is really important, and I think the interpreter needs to really be brought into that therapeutic relationship. So it's kind of like a circle of safety and a circle of care that includes everyone, including the interpreter. So that can be a little bit difficult to navigate as well. And finally, there's probably others, but these are just a few challenges that can arise, is this lack of specialisation. As I said, you may have a speech pathology interpreting assignment once every couple of months, which doesn't allow you to build up any kind of specialisation, whereas speech pathologists are doing what they do every single day. So that can be another challenge, because you're sort of expected to, you know, be on the ball and know what's going on, whereas you may not have had an opportunity to acquire any kind of specialisation in that kind of setting. So yeah, preparation, it's really important. Obviously, you all know that already. Preparing terminology, finding out about who you're seeing, what diagnosis they have. And I would really, really try and encourage you all to just insist on a briefing with speech pathologists before the session begins. It's just essential. You need to know what the speech pathologist's purpose of the session is, what they aim to achieve in the session. You need to see any materials that they're going to be using during the session. It's really essential, and hopefully there is a growing awareness amongst speech pathologists of the need for these kind of pre-session briefings. And you can, in those sessions, you can agree on strategies with the speech pathologist as to how you're going to manage difficult situations, or what the speech pathologist expects the interpreter to actually do during the session. So that kind of preparation is just essential. And I guess the last word that I would add to this is that as interpreters, you're just really great communicators. You've got an incredible talent for language, and you master language, you master English, you master 1, 2, 3 other languages. And it can be really challenging working with people who don't, and people who really struggle to get out a word or a sentence. So I think you've really got to equip yourself with a lot of patience when you're working in a speech pathology setting, because people that see speech pathologists do have enormous difficulties sometimes, and it can be very frustrating if you are a really good communicator to be trying to assist someone like that. So I don't know if we've got time for the case study, Party.
Probably not, but you know, we can send the case studies to our interpreters tonight, so they can have a look at that. But the essence of it is in regards to the preparation for the assignments, as well as the briefing and debriefing. Just want to make a note on that, is it's actually a part of the AUSIT Code of Ethics, maintaining professional relationships, is we have the right to a briefing and a debriefing, and we need to make sure that you know, we follow up with that. So please, especially in not just in all settings, but especially in speech pathology settings, as Liz just told us, briefing and debriefing is extremely critical.
And it can also be beneficial for the speech pathologist as well, because after a really intense session, it can be really helpful to be able to just talk about it for a minute with someone who was there.
Liz, thank you so much again for tonight. Much appreciated. Amazing work.
Thank you, Fatih.
All the best, everyone. Thank you.